Guys, welcome to Celebrity Fight Club podcast, and so excited for this show today with my man, one of the best plastic surgeons in the business, Dr. Jason Bloom. How are you?
Thank you. I'm doing great.
Yeah.
Damon, thank you so much for having me. It's been great all these years being a part of celebrity boxing. Years ago, the official plastic surgeon of celebrity boxing, and I continue to keep up with you, and it's been awesome.
But look at you, man. There's so many questions I have for you because I've never seen someone just blow up so fast. And thank God, you're doing an unbelievable job. You have the surgery center now. Your practice is going well. And why plastic surgery? Like how did you get into it, and why did you pick plastic surgery to be a plastic surgeon?
That's a great question. I started many years ago. My father is an oral surgeon, and I think that kind of got me interested in medicine. So from an early age, I kind of knew I wanted to do medicine.
Wow.
And when I was in college, I loved the idea of art and science. And I was a biopsychology major at the University of Michigan, but I also I had a minor in history of art.
Okay.
So I always loved that, and I loved the head and neck anatomy.
Sure.
I went and did my, even just like a step back, I thought I was going to be a neurosurgeon for many years, for the first 3 years of medical school. And then when you actually think about it, these neurosurgeons are amazing. They're doing amazing things, but they have patients that are passing away, dying, and due to no fault of their own. But these patients have aneurysms, inoperable tumors, and things. And talking to the families and the loved ones of these people, it's that was not for me. That was something that I could never do. But I loved the head and neck anatomy. I loved art and science. And doing, facial plastic surgery is really the melding of both. I get to be creative. I get to work with men and women. Yeah, I did a neck lift on a male today, and
awesome.
I operate on women, men, young kids. I get to see patients in my office. I get to see patients in the operating room. So it's a little bit of best of everything, and that melding of the art, really getting to be creative with what I do, and the science, understanding the anatomy and how the body works. It's been great.
Well, you love what you do, right? Do you get help every day? And I can't wait to get into the office.
I do. I love being in the operating room. That's really where it's kind of people call it, in the zone kind of. It's that flow state where, I operate. On average, a facial rejuvenation surgery can take 5 to 7 hours sometimes. Wow. And
but you are. I see what you're doing. You are you're doing masterpieces here. People look like another person, but still look great.
Right. That's the thing is I want them to look like themselves, but just rested and rejuvenated. That's really what we're going for. And people are like, oh, well, don't, after 6 hours or 7 hours in the operating room, don't you have to need something to eat? Don't you have to go to the bathroom? And it's not like that. It's just everything kind of shuts down, and you're so focused on what you're doing.
I love it.
It's interesting because you don't have to go to the bathroom because you're just putting all your energy and focus into that surgery or that case. And interestingly, if you've ever taken a test or something where you're so focused on it, and then the minute you're done with that and you walk out of it, it's just all that energy kind of rushes away, and you're exhausted. Sure. And it's not from the fact that it's just the fact that it's just so much energy going into one thing, and then when you're finished with it, it's just oh my gosh, that was crazy.
And I think you're in it at the time now. Now's the time. Everything is plastic surgery. Everything, every commercial, every social media post, you see a girl getting something done. Even now, the guys, and I think it's phenomenal. A woman has to do that to take care of herself. You live one life, so
yeah. I think now it's interesting because the with social media, certainly. The advent of that, it's so out in the open. Yeah. It's become a part of, really of everything we do, and people are so focused on social media and seeing people, whether it's their makeup routines, watching them do that, or they're detailing their procedures or whatever they're doing. The interesting thing in 2025 is that it's become so open, and the taboo nature of this has kind of gone away. Like people are like, oh, you know what? This person, this guy, or this woman is doing something to feel better about themselves, and like, go them. Like, way to go. It's not like considered like, oh God, look at them. They're getting
part
that
of life
done.
now.
It is.
You have to do it now.
It is part of what we see every day.
So when you had the vision starting out with plastic surgery, because I remember when you were starting, you had someone else, and you grew up, you were working with another company, and you started your own. Now you have your own surgery center. I remember how excited you were. Just tell everybody about that, how it was opening your own surgery center next to your office.
Yeah. So that was, a lot went into that. So I started my career, I worked actually with a dermatologist for about 6-7 years. And he used to joke, I did everything in the office that caused blood or smoke. So all the really aggressive lasers, all the injectables, and all the surgery. And after that time, like I was ready to do my own thing, and I opened up my own brand, my own office, and awesome. I hired a partner pretty early on, probably about 1.5 years, 2 years into it. And she's been great. Dr. Julie Strax is my partner. She's been amazing. And what's happened certainly in the healthcare industry is that a lot of the surgery centers and hospitals that are out there make money from insurance companies.
Sure.
And from doing those cases at a surgery center, they get reimbursements for the insurance company. So if you have an ACL tear and you go to see, an orthopedic surgeon to get your ACL repaired, they might get a certain amount for the surgery, but the surgery center gets a lot of money from the insurance company for doing that case there. The problem is that aesthetic surgery or plastic surgery is not, we don't take any insurance, and it's all cash pay.
Oh, got it.
So whereas we're getting the money ahead of time, the hospitals weren't getting the same big reimbursements for our cases that they were for, the orthopedic surgery or the podiatry or the pain, those kind of things were getting big reimbursements. So what they did was they started raising the costs for the patients to have surgery there to obscene numbers. They were like super, super high. And so almost to the point where like if you wanted a surgery, it would be like, I don't know, let's say $10,000, whatever it was. And then the cost, that would be like my cost. And then the cost to do the surgery was $7,000 on top of it. It was almost double what we were getting for the surgery. So what we said is we need to control that. We need to be able to allow patients to have surgery there at a more reasonable price. And then also, I wanted to control every aspect of it. How about walking into, the operating room and there's a scrub tech or a scrub nurse there. It's like, oh, what kind of case are we doing today? Oh, I don't do that. I usually do orthopedics, or I usually do, sinus surgery. So I'm not used to this. I mean, it was crazy. It takes longer to do a case when, the whole team isn't on point and firing on all cylinders. Now we opened the surgery center in November. We've done all of our cases there.
That's awesome.
It is just like a well-oiled machine.
That's
awesome.
To
the point where I put my hand out and my scrub tech knows exactly what to give me. It's just, we have a full team of anesthesiologists there.
Awesome. Yeah.
Everyone knows how we like the patients, how it goes. They're familiar with the surgery. Everyone's trained in plastic surgery. It's just, when you try to do something for the first time and you're explaining it, it just takes longer. This is now everyone is right on the same page.
No, it's awesome, man. What you built, I mean, this is like great knowledge because I'm all into this plastic surgery, pain relief. We're doing the first ever pain relief summit coming up, and I'm going to do the beauty summit. I have this thing. I love my career.
I love
doing these summits, though. I see because it's able to give. You're already in the spotlight with everything. You're always a guest on the shows and stuff, and it's an honor to have you. You're my man, but like. All these people, these summits, the doctors don't know how to promote themselves. So they get their opportunity to go out there. People like to know who's going to operate them or who's going to shoot them up with a Botox or something,
And it's good to hear from experts. And also, I'm constantly, I love to hear from other friends, colleagues in the industry who are good and knowledgeable. I learn a lot all the time too. So, that sharing of information, we do that on a very high level. Like when I go to a meeting, like I'm going at the end of May, I'm going to Vegas. There's it's one of the bigger spots for plastic surgery meetings.
Awesome.
But I'm speaking, I'm on panels, I'm doing live injections, things like that.
Oh, okay.
But one of the best parts is when we get to catch up with colleagues and, see how their practice is going and kind of share tips and tricks and things that are working and things that aren't. So it's as much for the people that we're teaching as it is for me where I get to interact with my colleagues and friends from across the country.
Well, you also, as being a plastic surgeon, doctor, your passion must be there. What does that feel like to be like, someone comes to you, their nose isn't looking good, or their face, something, lips, and all of a sudden you change it, and all of a sudden they're smiling, being, thank you so much. What does that do to you?
I mean, it's the best feeling. I mean, it's totally amazing to be able to change someone's self-confidence and make them feel better about themselves.
Absolutely.
And when that happens from the minute you walk in the door to see them.
Yeah.
Just the way someone carries themselves and you meet them for their first consultation, they're kind of their heads down and they're just like, I don't like this. And then after you see them for a follow-up and they're literally are jumping out of the chair ready to give you a hug. And that is truly the best part of my job.
I love that.
It's awesome. And some of these patients, allow me to post their before and afters on my Instagram. And I mean, what a better honor than that. I mean, because these are sometimes people, you'd be shocked. These people, they're super private. And I am shocked sometimes when somebody's like, you know what? You did such a good job that you can showcase this.
Absolutely.
Please put it out there.
That's great.
There's, they like to say, there is no, what do they say? No gatekeeping. They want others to know how happy they are. And I mean, that's a huge honor for me.
That is, because, what you do is so touching because girls I know, they talk about, oh, my nose and oh, my lips, my face. Well, okay, go see Dr. Bloom and he's going to fix you and you'll be brand new. Well, I'm your biggest promoter, right? Anyway, long story short. So with what's next? Would you be interested in doing making this into a franchise around the country? Is this something that could be built that way, or are you just happy with what you're doing and build upon it?
Yeah, I've never been a kind of expand to the point with people are, oh, why don't you open up an office in Center City, or why don't you open up an office in South Jersey, or why don't you expand that? And my feeling is I would rather grow from one location, and over the past 5-6 years that we've been there, we've taken on more and more space. So my central location is now 4,400 square feet.
Awesome.
We've got 8 treatment rooms. I have more and more team there. So I have my partner who's a facial plastic surgeon. We have 3 or 4 estheticians depending on the day. Yeah. We have 3 nurse injectors. So I would rather, and we have space to handle that.
Sure.
So I would rather grow within our space and just to make it a really great center of excellence rather than, he's at this office 1 day a week and this office 2 days and just kind of splitting myself up. I'm in the operating room anyway, as it is 3 days a week.
Yeah, sure.
So Yeah, I'm happy as it is.
Now, how many doctors? So it's you and another?
Me and Dr. Julie Strax.
Do you have any others out under you? Like are you going to bring any other doctors on?
So there's some talk of maybe bringing in someone in the future, maybe with like additional, interest to broaden the interest of our practice. So we'll see. That may be coming. I don't think coming soon, but maybe in the next couple years.
That's awesome.
I could maybe bring one other person on.
So I know you can't say names, obviously, but do you do a lot of TV personalities or any people in the spotlight? Because they, I know a lot of them need it. I know you can't say names and stuff, but
yeah, I mean, I've done a few. I would say both local and national celebrities,
That's awesome.
And but like for me, it's the same. There's no added rush to do a celebrity, because they don't want to put it out there.
Right.
I would rather do someone that lives right around the block and is just so happy that would rather put their results out there and say, look, this great job that Dr. Bloom did,
absolutely.
rather than doing some celebrity where they're like, I don't even, you see them out or, they're like, I don't even know you.
I know they won't act like they don't know you, but people in the spotlight, they have to get it done. It's just that's all there is to it. I'm sorry, I got this absolutely needed.
It's interesting. I mean, the great thing is what we're doing now is, I will say, looks fabulous, looks natural, is long lasting, and people are enjoying it longer. It's like kind of the day of undetectable procedures. That's awesome. Just like our techniques are so good now that patients are actually getting it done a little bit earlier. They're enjoying it for long, and it's nearly undetectable.
Well, so I want to ask you, what do you think what is the most popular things a woman wants to get done? Is it Botox or is it a nose done? Lips is the biggest thing, I guess.
Yeah,
right?
Well, I mean, it's interesting because in the last, if you look at the numbers with the American Society of Aesthetic Plastic Surgery and all the numbers, in general, aesthetic treatments, actually neuromodulators or Botox, those kind of injectables are by far and away the most common. Fillers, such as lip fillers and things like that, are number 2, and laser treatments are probably number 3. That's for the non-surgical things. In my practice, because I'm operating so much, I no longer take on new patients for injectables, but because we have an entire team that does that. If I was to take on all these new patients, okay, I'm still taking new patients to do their Botox or taking new patients to do their filler, then I'm just kind of not encouraging my team, my injectors, my partner to continue to grow their practice. It's stifling. And so I don't need to do that. I still have some patients. I'm trying to move more and more away from that so that I can do more surgery. And that's really what I love and what I want to do.
I love it.
But I still am very, very, very involved in teaching. Residents.
Teaching what? Teaching aesthetics?
Technique, yes.
Or lips and stuff?
Exactly. So teaching technique, teaching about the different products. I work for a number of different companies, teaching about their products. What's the difference between those things? Teaching different techniques for injection and just understanding and teaching the anatomy. I do cadaver courses where we do dissections to show people the anatomy. I teach my residents and the fellows. I'm the co-director of the Penn Facial Plastic Surgery Fellowship. So tomorrow I'm doing a facelift, a neck lift, an upper and lower eyelid blepharoplasty or eyelid surgery and fat grafting, and I'll have my fellow there to be basically showing them the techniques that I use to rejuvenate this woman's face.
That's amazing.
And so he's learning, and he's really the next generation of plastic surgeons, and that's how I give back. So, that's how I love it.
I mean, this is amazing. I'm so into this talk, man. So, someone say they look old or they're an older person, how many years do you think you could take off them by doing their face? I don't know if this question's ever been asked to you before. Like, what's the most popular thing to take the age off?
You know, two kind of parts to that, I will say. First of all, patients ask me, what is the most rejuvenating thing that you can do in terms of surgical procedures? I always tell them the eyes. Because if you do someone's upper or lower eyelids, you want that to be like, that's where they're looking. That's where it's the standout. That's the showstopper.
Yeah.
If you can rejuvenate someone's eyes. And it kind of takes attention away from everything else. So I would say some kind of periorbital surgery is by far and away the most like rejuvenating of all the procedures.
Yeah.
Now, the second part of that was there's been some recent studies, and AI has been a huge kind of like buzzword, in our industry. And what they're doing is they took patients who had eyelid surgery or facial rejuvenation surgery. So let's say eyelids, facelift, neck lift, that kind of stuff. And they looked at the pictures and they had AI evaluate it. And they've done, they've used, Amazon has their AI and Google has their AI, and they're all different. And they said in the study that patients look on average about 7 to 10 years younger.
Really? Wow.
So it was really interesting. And that's just based on, have you ever done this? You take a picture of yourself and ask AI, how old do I look? It will evaluate the picture and tell you about how old you look.
How's that happen? The picture, if they show you, you got to give them a picture?
Yeah. So like you take a selfie of yourself and then submit it and say, based on this picture, how old do I look? Well, and it will calculate some of the things that they look at for aging, aesthetics, your skin, your facial wrinkles, your volume of your skin, your jawline, different kinds of things, and it will spit out a number for good or for bad.
Wild,
right?
Wild. I got
some people. Maybe some people don't want to see that, but yeah, that's a hot topic in our industry right now.
So what's the first thing on the face that goes old, or like, I hate to say it like that old, but you notice that, man, it's time to go see Dr. Bloom? Or
I think like in a young person, like probably their upper eyelids start drooping a little bit.
Yeah.
And then, this is interesting, but when we're talking about the eyelids, I don't even say it's an age-related thing, but a lot of men and women begin to experience bags under their eyes, and they're like, and some of these, I've done surgery, lower eyelid surgery on 28-year-olds.
Wow.
Because they're like, my eyes now look exactly like my mom or my dad. I see where this is going. I want to take care of it ahead of time.
Yeah, right.
And, I've posted pictures of some great results of some women in their 20s and 30s, and we can do a surgery to like make them feel and look more rested.
Well, that's the thing. Like, so girl, you said 28. I knew girls 21, 22. I might get names, but they're even getting Botox now. Why is it such like a craze right now that like even young women are still thinking they look old at 22? You know?
I mean, well, I will say I do think that there is some. And this, I will say, is also a very hotly argued topic right now. But I do think that there is some, kind of like prejuvenation that you can actually prevent wrinkles or lines by doing some conservative things like neuromodulator, skincare, lasers at an earlier age, and actually prevent the onset of static lines or wrinkles.
Wow.
So like some of the lines and wrinkles in our foreheads and in between our eyes are caused from like constantly like, squinting, bringing your brows together. All those things will develop those lines. If you start and just put a little bit in some of these areas conservatively, that will prevent the etched-in line and wrinkle in the future. If you're on top of your skincare, if you're on top of wearing sunscreen, that's going to prevent fine lines and wrinkles, pigmentation. All those things you're setting yourself up for not having to do as much in the future.
So I have something. So say someone never took care of themselves and they're 45, 50 years old and their face isn't looking great. Can you actually really redeem them, just like make them brand new?
I mean, to a point, but there's things like that. You certainly have to be more aggressive and do more in a person who, that needs more work. And so and a lot of times when a person is younger, mm-hmm. Patients are choosing to have procedures done at an early age so that it's not such a drastic change, right? So if you look at all comers in my practice, it used to be late 50s to 60. Yeah. Those were men and women coming in for facial rejuvenation procedures, surgery, facelift, neck lift, eyelids, those kind of things. Now, I think it's early 50s. 52, 53, those are the more common ages because they're when I'm 65 and I have a procedure and then I look like I'm in my early 50s, that's like a shock. That's wow, that person looks good, but they look different. It's people are going to be like, that person looks good, but they look different. Whereas if you're in your early 50s and set yourself back 10 years, now you look like you're in your 40s. It's going to it's wow, did she just go on an amazing vacation? She looks so great.
They got to take care of themselves too. They got to work out. I agree. I always believe men and women, no matter what, I don't care how old, they got to work out. A girl has to work out, and then she gets the plastic. Then she's top notch. You know what I mean?
It's interesting that you say that too, because in 2025, nothing could be more true, especially with what we're seeing with some of the weight loss medicines.
Sure.
So the GLP-1 agonists, so the semaglutides, the tirzepatides, the Ozempics, the Mounjaros, those kind of drugs, is that they're causing patients to lose a lot of volume on their body, right? They're losing a ton of weight, but they're losing volume in their face, and they're not just losing fat, but they're losing lean muscle mass. Right. So what we're telling patients and we have a program in our office to, for these medicines, they're unbelievable, but you have to work out, you have to diet, you have to exercise, and you have to, consume protein.
Sure.
Because they're if they're not building muscle, you're going to lose muscle with these drugs too. So it's important to maintain the muscle.
Great knowledge, man.
Take protein, keep your protein stores up, and continue to work out. That's going to help, not just their body, but also their face.
So I appreciate that because that's some stuff I was always thinking about. So I just want to back up a second. So if you're a girl in her early 20s, you're starting to get Botox now, and different things. When you're 22, then when you end up being 50 or something, is that bad? Can it hurt her?
No,
later?
I think that's good. I think what's going to happen is they're going to need less done when they're older because they've been keeping up with it.
Does Botox take stress out of you for some reason?
So I don't think it takes stress out of you, but there is great research out there, actually in the psychology literature, that says Botox can help with depression.
Oh, wow. Really?
And just the way that you're perceived by others, because you're not in a scowling face, others look at you as happier. Right. And actually there are tons of research papers out there looking at how Botox can be used in a positive way to fight depression.
Wow.
In that you can't make some of the faces, the scowling faces, if you have Botox, and it's actually changing people's outlooks.
Wow, man.
Yeah.
That's strong words right there.
It's really amazing.
We have Mental Health Awareness Fight Night coming up with the Pain Relief Summit, but that's a big part right there, man. I didn't know. That's some strong words to know.
It's really interesting.
So we just found your way to be a speaker at the Pain Relief Summit, right?
I need to do a little bit more research on it, but I know that stuff is out there.
That is incredible. So one more thing I want to touch on, and I appreciate all the time, and Just excited to have you. So men now, a lot of men are getting into like plastic surgery, Botox. I think Botox is good to do because you got to remain looking young.
Totally.
Especially if you take care of yourself. It's
Yeah.
very important. Why is it so important? And why is it fine for guys to be doing all the plastic stuff?
So men are in the workforce. Men are competing for jobs against younger, younger people. And like I said today, I did a neck lift on a gentleman who's still working. He's in medical device sales. He's like all of the guys who work, on my team are significantly younger. And he's like, I still want to feel good about myself. And he's like, I got this turkey waddle that's bugging me. And why shouldn't men feel good about it?
Absolutely.
I've been a proponent of it for years. I use, medical grade skincare. I've been getting, neuromodulators, Botox, Dysport, all those for a long time. And like my favorite thing that I have ever done was I am now a year after getting a hair transplant in my office.
You look phenomenal.
And it was unbelievable. It was the best thing I ever did. And I'm super open about it.
This is the most talkative you've ever been too, man. Yeah. The confidence you got now.
Oh, it's unbelievable. So Dr. Strax, my partner, did it, and we both do them in our office. I did one on Monday. I did one last Monday. Dr. Strax has one coming up next week, and it is unbelievable. You're really like taking the individual hairs from the back and transplanting them. It looks so natural. No one. I put my whole journey on Instagram and on social media, so I am certainly not shy about it at all.
I'm so proud of you.
But it was, I still have patients come in every day and they're like, my gosh, I thought it looked good, but your hair looks amazing.
Every time I see it, it looks thicker.
Yeah, it looks awesome.
So what's the difference between the turkey one and what you do?
Great question.
Yeah.
So medical tourism, going to Turkey, and they call the airport in Istanbul, they call it the hairport, because a lot of people are going there because it's cheap, and the problem is there's less precision. They're looking more kind of like, so when we do a hairline, you want to stagger it so that it doesn't look like straight across. Some of these hairlines that I'm seeing out of Turkey, it looks like, they're like straight across. They're not varied. So this is not a procedure that happens in 5 minutes. It takes like 8 to 10 hours.
Wow, interesting.
And when you actually see this done, each individual hair, what we call them follicular unit, which has either 1, 2, or 3 hairs in it, is individually removed and then transplanted by hand. Now, that is like, it is like a handmade product. It is really, it takes a lot of skill and a lot of expertise to do this. Interestingly, we just actually got what's called the Artis AI robotic hair transplant device.
Wow, that's crazy.
So now
it's unbelievable.
Well, when I do something, I'm like, I want to give. I want to give. I do. I am a scientist at heart. I love the data. I love the knowledge. But when I do something, I want to have every option available to patients. So we have non-surgical hair rejuvenation with PRP and that kind of stuff. We have surgical hair restoration. So we can do it by hand, and we now have a robot that when I did my hair restoration, it was 2,600 grafts. Imagine the human hand coming in at the right angle 2,600 times.
That's crazy.
It's hard to be that accurate.
Yeah.
We have an amazing team that has done this for 18 years, and they're super at it. But now we can actually tell the robot the degree we want it to come in at, the number of sites that we want it to make. Not only will it use AI, these cameras in this robot read the scalp at 100 times a second.
Holy, wow.
That's like 10 times more than a human eye can do. Human eye can read at best 12 times a second. This is 100 times a second.
That is amazing.
And it knows which hair follicles are the best to take. It measures the exit angle of the hair. It knows exactly which angle to come in to pluck the hair out. And it knows when it's making the site the exact same angle that it wants to create the site so that you can put it in at the right angle.
That is crazy. But let me ask you, that is something. How long does a process like that take to get done, and how long does it take to grow and things like that?
So when we do the actual procedure in our office, it takes about 8 hours by hand. It takes about 5 to 6 hours when we use a robot. It's exceedingly faster. The robot can make about 3,000 sites in an hour.
So it takes 1 day, 8 hours.
Yes.
Then how's the process go?
So the hair is based on a cycle, and that cycle is 6 months. So there's a growth phase and a sleeping phase of hair. It takes I would say it took a good 4 months to begin to see some of the new growth. And then, it's a full year. So I'm where I should be. But I would say by about 8 months, it was super dense. And nice. By about a year, it's been amazing.
It's been a year now?
Yeah.
Wow, man, you're brand new now.
I know.
The brand new Dr.
April 4th,
Bloom.
2024, I had it. So it is literally a year.
That's awesome, man. This has been a great talk, man. I think, especially about the Botox thing, because guys and women, this is their thing. Now, is there, like, if someone's getting Botox, what's the precautions? Like, is there any, I don't know, side effects at all?
I tell people this. Botox is safer than Tylenol.
Right.
And that's
it's good for migraines too, right?
Yeah, it is. It is FDA approved for migraines. So like neurologists inject it for migraines on labelly. It's approved for that. So like Botox is super safe. It actually works on the muscle right in that area.
Right.
So like the biggest risks are also, and the reason why I say it's so safe is it always returns to normal. Right. Botox goes away.
That is, yeah.
You take a ton of Tylenol, and you get liver failure. You can die from that.
Yeah, sure.
Like this is a medicine that the results are temporary, always.
Right.
There's never been a permanent issue with Botox, and so that's why it is so safe. I mean, you need to go to. I mean, nowadays everyone is doing this.
Sure.
Meaning, not just the people receiving it, but the people injecting it. So you need to go to someone who understands the facial musculature, who does this a lot. That's like the most important thing. You got to go to a reputable provider. Nowadays it's like you get what you pay for. Someone's selling Botox for, significantly cheaper. Yeah. That's kind of like,
sure.
That's got to raise a little bit of red flags.
Because everybody tries to jump on a bandwagon.
Totally.
They're trying to be hustlers, but then you're hurting someone. I don't think it's
and
good.
Listen, I never tell someone they can't do this, meaning like I know doctors, nurses, PA, all these people doing it. And like there's room for everyone.
Oh, sure.
But like if you're the consumer, you also have to do your research.
Oh, absolutely, 100%. And last question, two more things. So, what's more popular? You think the lips or getting Botox?
Definitely Botox. And probably double.
Yeah.
The number of patients worldwide who get, even in the U.S. and worldwide, who get neuromodulators or Botox is probably double the amount of patients who get filler.
Right. And when you get Botox, how long does it take to show the effect?
We like to say by about a week or two. Some brands tend to work really quick within like 2 days. But it takes at least probably about a week to really kind of like kick in, smooth out, and like totally activate.
Yeah. So I know you're a big Eagles fan. I know you're the king of sneakers. What's next for you? What's next for Dr. Jason Bloom?
Gosh, what's next? I think I want to like continue just doing what we're doing, man.
Keep the journey going.
Yeah, just ride the wave, continue to build, continue to grow locally, and to just like just refine things and make the patient experience great. Patients come to me not just for like the great results, but the patients can tell that I really care.
Without a doubt, yeah.
Like on the way over here, I called my patient for tomorrow's surgery, and I told her I was thinking about her. On the way over, right before I left my office, I went over her chart. I went over the surgery. I call every single patient the night after their surgery, the night before. They have my cell phone. I do all these things to like actually, patients understand they're getting me.
Yeah.
I'm doing the procedure, and they feel like I'm taking care of them.
That's what's so important. That's why you're successful. Others, they do it half-ass or whatever. But listen, man, this is great talking to you. Honestly, always great to have you. Dr. Jason Bloom, and everybody can find him on Instagram at
Dr. J. Bloom, Dr. J. Bloom.
That's right. And his big office is in Bryn Mawr. Go see him. He'll change your life. And the Celebrity Fight Club podcast, Dr. Jason Bloom.